I'm Asian myself. I've got quite hairy ears, and a lot of Asian clients that I treat, they also have proportionately, I would say, more hairs than Caucasian patients. So I think there must be a cultural difference there, and it kind of partially makes sense to me. So from this the hair strands at the follicle, you've got the sebaceous glands, which excrete sebum, which is an oily fatty substance, and the ceremunous glands. So they secrete an oily sweat. So if you're from a hot climate, you're probably going to want more sebum to help protect the skin, to provide lubrication so the skin can retain its internal moisture. Without that layer of oily fat, the sebum, moisture within the skin cells can rise to the surface and evaporate. And also sweat. So in hot climates, we're going to sweat more, so we're going to have more ceremunous glands, so we're going to have more hair strands. So, and from Asian descent, we're typically from hotter climates, so from India and South Asia and East Africa. So when I think about it logically, it kind of makes sense. I'm sure that's not the reason though, but it's a plausible one at that. And finally, it's the consistency of the earwax. This is quite a mushy wax, and you can see now, I've just introduced the Jobson horn, and it kind of demonstrates how mushy it is, because although the Jobson horn did remove a bit of wax there, but what it actually did, it spread the wax, because it's so soft and mushy. It spread it against the bottom of the ear canal, so hence why I put the olive oil spray in straight away to help to bind that wax together, loosen it off the canal wall. I initially said the ear canal width, the entrance, is about 3 mil. I'll take that back. I think it's about 1 millimeter. It's actually smaller than the suction probe. The Zollner suction probe that I'm using is around 2.1 millimeters at the outer diameter, and it's too large for the entrance. So as I'm bringing this wax out, it is breaking up into little pieces, because the wax, once you get through the entrance, the ear canal actually widens and protrudes outwards. So the wax filling that space is actually larger than the entrance of the ear. And you can see I'm having to wriggle it out. So there's quite a few challenges. You've got a narrow, almost collapsed entrance to the ear canal. You've got then quite a bendy second bend. You've got the consistency of the wax. You've got the hairs that are slightly obscuring the view. But nonetheless, we managed to remove this. But there's a bit of dead skin here on the posterior part of the ear canal, and I just thought I'd try and remove it, but it was very difficult. And in the end, I couldn't remove this. We just left it. It's not a significant, it's not going to improve the patient's hearing per se. The symptoms on this side are completely eradicated and alleviated. So I am going to have one more attempt at that skin. And that skin now should just naturally shed by itself. That skin has already begun the shedding process. You can tell by the colour. It's gone dead skin. As it's firstly shed, it's whitish, and then you can see there's a bit of whitishness there. That's kind of more fresher dead skin, and then it's more yellow. The yellower it gets, the more longer it's been there. And the patient found that slightly uncomfortable, that bit. When I was trying to pull it off the eardrum, you could see a patient flinched a bit. So I just stopped. We don't want to cause any trauma. So the left ear is treated. Now this is their right ear, and you can see the outer part of the ear canal is really wet. They've been using, obviously they had this ear irrigated, so it was wet. They've been using drops, given antibiotic spray. I don't think they actually used the antibiotic spray because they weren't sure themselves. They weren't convinced that they had an infection. The patient just felt it was due to the irrigation that they had performed. And it'll be difficult to irrigate this ear because just getting the nozzle in, again, this ear canal's completely, the entrance, it's almost shut. And I think